Hi guys, welcome back to my channel, Postcard Eyes Unfiltered. I am representing in the lippy department. I've got Sushi Kiss on today by MAC. Of course, I love my MAC products. Let's get into it. We will be talking about yet another topic. I know, I have these topics and they just keep coming as, I just think about them and let's just get into it. Welcome back to yet another episode of the conversations you should be having with your significant other if you are thinking of going the long haul. And on today's topic, or today's episode, we'll be looking at reproductive challenges, reproductive issues, or infertility in men and women. Let's get into it. In today's episode, we will be looking at reproductive and infertility challenges and issues that are plaguing men and women in today's world. When it comes to relationship dynamics, it is imperative that you have all of these conversations, and I know the not so comfortable conversations oftentimes is hard to start or hard to initiate, but I'm here to give you a guide as to what type of questions you should be considering and the way to go about having this conversation. Let's go. So I know that male infertility as well as female infertility is a very important subject area or subject matter when it comes to our health. And when it comes to the dynamics of a relationship, these are conversations that vary in different aspects, and we essentially don't get to get into that conversation, get into that uncomfortable discussion. And here it's not, understandably, disclosure doesn't have to happen at the start. Understandably, not having it, however, is a recipe for disaster. Why, you will say you are the one that would like to have kids. Now, when both of you don't want kids, that's a different level of understanding or different conversation that should be had. But you both agree that kids is something you see in your future. And you are 6 years into the relationship. And all of a sudden, you're waiting to get pregnant, or the other one is expecting you to get pregnant and it's not happening. And that's 6 years that you guys have committed to the relationship. And you find out one of you has got issues that wasn't disclosed at the start. Imagine you are front and center, or you are in this sort of relationship. How would you feel? Like you are deeply and madly in love with this person, having to then say, I don't want the relationship to continue anymore after 6 years of fully investing your emotions into this person. And you tell yourself, because of this is not going to go on. It doesn't sound right. It sounds like a betrayal of trust, a betrayal of, the time wasted. And so why not avoid this disappointment after a time that's passed and start the conversation whilst dating? You don't need to fully disclose, but having the conversation at the start sets the tone for what is to come. Sets the tone for the transitional journey that you will be making with this person that you're with. When we talk about infertility and reproductive challenges, they vary in different aspects. You have the genetic defect, which could impact on a male or a female having to be able to conceive or start the conception process. And then you have lifestyle changes or lifestyle effects as a result of the choices you or your partner would have made in their younger years. That plays a significant role in your ability to reproduce. We do have the hormonal impact that can, result in a delayed conception or affect the conception process itself. Whilst all of this are stated, textbook-wise though, there are ways to circumvent or correct some of these problems. But again, when you have the conversation, and that gets things started in order to fix, if possible, or however it will be, to make it easier on the both of you to reproduce. Let's look into this varying types of infertility or reproductive challenge in details. Now we'll talk about infertility issues in women. There's some common causes. We've got the ovulation issues, which includes polycystic ovary syndrome, hypothalamic dysfunction, primary ovary insufficiency, as well as too much prolactin. All of these have got an adverse effect as to the procreation process for a woman to occur successfully. We also have damage to the fallopian tubes as well as endometriosis. It's a very common issue that women often face, and there are risk factors that oftentimes is associated with infertility. We'll talk about age. Now, you know the also familiar biological clock, guys. That is a thing. It is. The biological clock of a woman keeps ticking, especially when she gets over a certain age, mid-30s, I think. And yeah, that plays a significant or puts an impediment in her conception journey, or if she is going to procreate. But again, these factors are oftentimes, not 100%, but they are there as risk factors. You got smoking, you got weight, you got sexual history. Now, sexual history can also include sexually transmitted infections that you would unknowingly must have had, and the ones you know you've had. Those does affect reproduction, and that's exactly what it is: impediment to your reproductive process. We have alcohol abuse as a factor as well that plays an important role in conception. Now, there is this other one that comes to when a woman in her younger years, commits to too many fetal, should I say, removal, what we normally call DNC. Now, if you have a successive amount of that, your chances of having a baby becomes slimmer. I don't know. I can't tell you the medical maths behind this, but for me, I feel that also plays a significant role, especially when you're in a third world country and you go to visit a quack for most of these procedures and it isn't done right. So there you have it when it comes to female infertility, or the causes and risk factor that is associated with female infertility issues. Now we'll look into the male infertility and the likely causes and risk factor. Now, when it comes to male infertility, which is often not talked about a lot, you have the causes which could be in the form of abnormal sperm production, where the testicles are undescended due to or in no part to genetic defect, or health problems such as diabetes and heart conditions. It can cause a number of issues. You have problems with the delivery of sperm due to premature ejaculation. We have overexposure to certain environmental factors that could result in infertility in men. There is also the undiagnosed effect or the other unexplained causes as a result of treatments to certain illnesses they may have acquired. Sexual history again also plays a role, where you probably must have contracted a sexually transmitted disease or an infection without knowing it, and it has gone untreated for years, which then can impact on your ability to procreate, essentially. All of these are high risk factors. You've got overweight as well, smoking, alcohol abuse, drug abuse. These are significant risk factors that can impede your ability to procreate. I know modern science has, made it a little bit easier for men and women who have got certain infertility issues to be able to overcome and, have kids after treatment. And that's thanks to modern medicine. I am all too happy, but that's not the point here. The point I'm trying to make is you not having to disclose at the start kind of would delay or take away from the both of you planning an alternative when infertility challenges plagues the both of you. I want to say this, and this is very, very prevalent in the third world country, especially in Africa, where women are taught to actually be the major issues when it comes to infertility. You could hear a couple, after being married for decades, and their in-laws are coming to blame the woman for not having babies. And you are wondering, oh my God, I would think procreation actually involves two people of the opposite sex, a male and a female, an ova and a sperm to, come together and to make conception possible. Why blame just one sex for the reason behind kids not, being present or not having kids? It is a false narrative that Africans, perpetuate a lot. And I think we should start easing off on women. We can't be the only ones, responsible for procreation. That's ridiculous. It is ridiculous to say the least. Now, again, the importance of having the conversation is that when that conversation is had, the both of you can come out and say, hang on a minute, this is exactly where we are at. I am fine, probably my partner is not fine, or she is fine, he is not fine. And in that regard, please back off our relationship while we sort through our mess. Stay away. And that's, again, you guys have the information in your hands to be able to defend or put the naysayers at bay when all of those mouth whispers come around. And that's exactly why this conversation just is so imperative. I cannot emphasize it any further. I've said important so many times that I've lost track. Yes, please have the conversation. Get talking. Communication is the bedrock for a solid relationship to go on and thrive. I cannot tell you how important that is. Again, I said it again. Have the conversations, know your partner in and out, get them talking. And guess what? Infertility challenges, however it plagues your relationship, it's not the end. There are options. Adoption. We all know this. You can adopt babies. You can go get a surrogate. Thanks again to modern science. There is the option to, explore sperm banks and egg banks. These are options that is available to you in order to make that dream of having family, if that is your choice, possible. I am not coming from a place of authority. I am speaking based off of a personal experience, observation within my environment and out of my environment as well, and helping you start that process of getting in deep with your partner, knowing all that there is to know before you commit to a lifelong term decision. Until next time, guys, where we handle another important question you should be having with your significant other to make your relationship a success, is be safe and bye from me.